Hello and welcome to Health Sense. I'm Yvette Mitchell. 2010 marked the opening of CoxHealth's Meyer Orthopedic Center, a unique state-of-the-art facility dedicated to bone and joint procedures, offering the most complete orthopedic care in Missouri. Judy Stewart of Republic endured pain in her knees for years before becoming the first patient to receive services at Meyer Orthopedic Center.
Well, I was experiencing some severe pain in the right knee, especially whenever I was trying to climb stairs or trying to do any kind of low-impact exercises or just even walking, just trying to get to work, walking around, in my office or whatever. I was eventually having to use medication and using a cane in order to stabilize myself, in order to, to get around.
What happens is as we get older, the water content in the cartilage increases, makes it more susceptible to injury. And as people have been maintaining a more active lifestyle later in their years, some of that cartilage can sustain trauma or micro-trauma that eventually leads to the cartilage becoming thinner. And ultimately what can happen is the bones can then be to the point where they're rubbing against each other and causing pain on an everyday basis.
So he'd put me on some light pain medication, and he told me to do some exercises if possible because he still wanted me to be able to move the joint. And so I tried all those, and to no avail, it didn't work. So he suggested that I go ahead and go through with total knee replacement.
Patients should try some easier things first, or some conservative management. But once those efforts have been tried and still haven't given the patient enough relief, that's when it's appropriate to have them come and visit with an orthopedic surgeon to discuss whether or not joint replacement surgery is for that person.
I was the first patient into the surgery room in the new Meyer Orthopedic Center in the surgery area, and I went into the new area where they have the patients' rooms. Very nice, very nice. It was like the Ritz, and I really appreciated all the attention that I got, and I felt like it was really exceptionally focused on the patient. I thought that they had such wonderful expertise. They had, you might say, special picked their staff to come over to the orthopedic hall. And they were all very skilled and very much aware as far as what they were supposed to be doing with the orthopedic patients. They scheduled my rehab the next day after my surgery. They got me up. We did a little rehab down in the main rehab area here at the Meyer Orthopedic Center, and it was pretty intense, but it was all for the good because that enabled me to be much more independent as the time I went home. I had the surgery on a Monday, and I went home on a Thursday. And within 5 weeks, I went back to work. And I feel a lot more confident in being able to carry myself. I lost 25 pounds because I went back to working out. So I was able to go to the gym and do the exercises that I once had done. I felt like I was much more a person at home also because I was able to do domestic chores, which my husband was very relieved about, and also to be a grandmother again. I was able to get on the floor and play and be as far as much more in tune with all the activities that were going on.
Within 2 to 4 weeks, patients are already feeling better than what they were before the surgery. So you can really make a difference in a person's life, and that's what really makes my job enjoyable.
You can learn more about the services provided at Meyer Orthopedic Center and hear other patient stories right here at CoxHealth.com. Until next time, I'm Yvette Mitchell for Health Sense.